Hi everyone, welcome to another episode of Sped Talks with me, your host, Donna Steele. In today's episode, we're gonna touch on attention deficit hyperactivity disorder. This came at the request of one of our viewers. I had intentions of doing it, but not so early on. But nevertheless, we're going to have a look at it, and we're going to look at the prevalence. We're going to look at what it is. We're going to look at the types, or the subtypes rather, of this disorder. And it will be a two-part episode. So this week we will look at, as I said before, the prevalence, the definition, and the types, and how it manifests itself. Next week, we will look at those evaluation procedures that need to take place for diagnoses, and we will look at some other strategies, things that teachers and parents can do to mitigate somewhat where this disorder is concerned. So that's the plan. So two-part episode starting today, and then we'll conclude next week. So let's see what this disorder is all about. All right, guys. So as said before, today we'll be presenting on attention deficit hyperactivity disorder, otherwise known as ADHD. So that's what we'll be presenting on. Back in the day, we had what was called attention deficit disorder, which would be ADD, which pretty much left out the hyperactivity aspect of it. Now we just kind of use one terminology, and it will make sense as I go through, because it manifests itself differently, where you'll have the inattention, some you'll have the hyperactivity, and some you'll have a combination of both. So to define ADHD, according to Hallahan and Kaufman, 2003, attention deficit hyperactivity disorder is a condition characterized by several problems of inattention, hyperactivity, and or impulsivity, which means you never know what you're going to get with somebody who is impulsive. All right, the prevalence of ADHD. ADHD is the most common behavioral disorder in children in America, and this was based on a study done by Collins et al. 2001. I don't have data as far as its prevalence in Jamaica. We can speculate, but I don't have facts, so I will not even try to speculate in the Jamaican situation. It exists in between 3 and 5% of school-age children. And so you might see some of this if you work with students in 3 to 5% of those students, which would be K through 12. Boys are more often diagnosed with ADHD than girls, ranging somewhere between a 2.5 to 1 ratio and 5.1 ratio. And this might be because boys' natural inclination is to always be on the go, always just kind of, be a little bit more curious. It might be just the fact that it manifests itself that way, where boys are concerned, just because the nature of how boys function is a little bit different from girls. Girls that do have ADHD, according to Boschett, 2002, most likely have the inattentive type. And we'll talk about that a little bit more in terms of the different types of ADHD or subtypes. Less than half of the children who have ADHD use special education programs in school. And I want to point attention to this as far as the US situation is concerned, just because their evaluation process is a little bit different, and just because they have in-house school psychologists that once a teacher or a parent or somebody who works with the student gets an inkling that something might be off, the school psychologist is there and ready to perform evaluations that could ascertain possibly that a child might have ADHD. In the Jamaican situation, we don't have that readily access, so we speculate a lot. And as such, these students don't necessarily get the access to special education programs because we're not sure if they're not diagnosed, they weren't evaluated, unless it's really bad and parents have real concerns about it and teachers or they can afford to do it, then those students are still placed in the regular education system, not getting their needs met. So two different situations. The Jamaican situation, they can say definitively that less than half of the children who have ADHD use special education programs in school. While in our situation, we can't really put a number on it because there's not much data to say that. Causes of ADHD, the exact causes of ADHD is pretty much elusive. There's not a definitive where we can say this is really what caused ADHD. Currently, most research suggests a neurobiological basis, which has to do with the brain. Since ADHD runs in families, inheritance appears to be an important factor. And that is something we find that this type of disorder usually there are cases where family members, close family members have the disorder, and you find that it seems as if it might be hereditary. I cannot say that definitively, but according to the US Health Department of Mental Health, this is what they are seeing. There are three types of ADHD. ADHD, the predominantly inattentive type, which I kind of alluded to earlier when I spoke about girls having the inattentive type. ADHD, predominantly hyperactive impulse type. And then you have ADHD, the combined type, which is a combination of being inattentive and hyperactive as well as impulsive. So three types, which we'll look at a little bit more in-depthly in the next coming slides. The signs of hyperactivity and impulsivity. So this is what you might be seeing if you suspect a student has it or if a student has been diagnosed. Feeling restless, often fidget with hands or feet or squirming while seated. Running, climbing, or leaving a seat in situations where sitting or quiet behavior is expected. Blurting out answers. This is where the impulsivity part comes in. Blurting out answers before hearing the whole question. Having difficulty waiting in lines or taking turns. This should read taking turns instead of tours. I apologize for that typo. So that is what it might look like in a case where you have the hyperactivity and the impulsivity manifesting itself. Signs of inattention now. So when we're talking about inattention, they're distracted, they're not paying attention. Often becomes easily distracted by irrelevant sights and sounds. So the least little thing distract them, things that seem insignificant to us. Often fail to pay attention to details and making careless mistakes. And we see this all the time with some of our students. Rarely following instructions carefully and completely losing or forgetting things like toys, pencils, books, you name it, they lose it. Often skipping from one uncompleted activity to another. So you see where they're not completing tasks. You see the incompletion of the schoolwork. And you wonder how, it's almost like they started and they don't remember that they're supposed to finish it. The symptoms, typical ADHD symptoms arise in early childhood. So you start to see evidence of that, unless associated with some type of brain injury. Later in life. Some symptoms persist into adulthood and may pose lifelong challenges. So pretty much what I'm saying here is that a lot of the ADHD symptoms arise in the early childhood. You start to see whether a child might be inattentive, whether a child is hyperactive or a child has some level of impulsivity. Sometimes you might see one and not the other. And as they get older, you start to see if they do have ADHD, all of, especially the combination type, you might start to see it little by little. So that's what I'm saying here. And some symptoms, as it said, into adulthood, of course, may pose lifelong challenges, because if you're now an adult and you have no idea how to curb certain behaviors that are associated with ADHD, one can imagine that it will pose lifelong challenges. All right, now that brings us to more symptoms. In children and teenagers, symptoms must be more frequent or severe than in other same age children. So when we're looking at their peers, if it's more than what the average student or child displays, then it's a problem. In adults, symptoms must affect the ability to function in daily life. Persist from childhood, and the behaviors must create significant difficulty in at least 2 areas of life, whether that be work and school or just your social life. Symptoms must be present for at least 6 months. So when we're talking about a diagnosis of ADHD, this is what we're looking at. We're looking at whether the symptoms affect daily functioning. We're looking at if the symptoms are more frequent than your neurotypical student or your neurotypical child. We're looking if the symptoms are consistent for months, at least 6 months. Not pockets of it popping up within the 6 months. Now I want to focus on the criteria for the 3 primary subtypes. So we're going to look at the 3 primary subtypes, but we're looking at the criteria. What pretty much forms the basis for diagnosis of ADHD? What are those criteria? For the inattentive type, we're looking at whether it fails to give close attention to detail, whether a student rather fails to give close attention to details or makes careless mistakes. So on one of those rating scales that they use for evaluation, these are some of the questions they may ask. Does a child pay close attention to details or make careless mistakes? So a teacher would respond to one of the rating scale, or a parent or a guardian or anybody who works closely with the child. Does the child have difficulty sustaining attention? Does not appear to listen? Struggles to follow through on instruction? Has difficulty with organization and executive functioning skills? Avoids or dislikes tasks requiring sustained mental effort? Loses things, is easily distracted, is forgetful in daily activities. So the inattentive type, these are some of the criteria that we will focus on when we're trying to say, yes, this child has this type of ADHD. The hyperactive impulsive type, it manifests itself through these: fidgets with hands or feet or squirms in the chair, has difficulty remaining seated, runs about to climb excessively, difficult engaging in activities quietly, acts as if they're driven by a motor. So imagine a car, if the student is showing symptoms of that kind of behavior, talks excessively, blurts out answers, difficulty waiting or taking turns, interrupts or intrudes upon others. And again, we're talking about consistently doing these things, not out of the blue, but all the time. And the other type is the combined type. So the first one, the inattentive, the second, the hyperactive and impulsive type, and the third is the combined type, where we're talking about both types. Individual meets both types of inattention and hyperactive impulsive criteria. So they might have criteria from both of those that I presented earlier. because everyone shows signs of these behaviors at one time or another, the guidelines for determining whether a person has ADHD are very specific. To be diagnosed with ADHD, individual must exhibit at least 6 of the 9 characteristics, or in either or both. So we're looking at 6 of those characteristics from the inattentive type, 6 of those characteristics from the hyperactive impulsive type, or both are so you're looking at that from either type or combined out of the 9 characteristics. So you can look at it separately or you're looking at it for both. And this is based on the Diagnostic and Statistical Manual number 4, where categories, as far as the categories are listed above. And we'll talk some more about what this Diagnostic and Statistical Manual is. And I'm going to stop here because this will take us into some other areas of ADHD, more specifically how it is evaluated, how it is diagnosed, and we will look at some of the behaviors and how to mitigate against those behaviors from a teacher perspective as well as from a parent perspective. So if you have questions, as always, shoot me an email, a text, a DM, whatever, and I will be sure to get back to you. So next week, we will conclude with part 2 on ADHD. So there you have it. Part 1 of part 2 down. I hope you got what you needed out of it. For those viewers who actually requested it, I hope that part 1 provided you with a better understanding as to what it is and what it looks like and those different types and the prevalence. And next week we will conclude, but feel free to shoot me your questions, your opinions, your perspectives as usual, and I will be sure to get back to you. Thank you for joining me for another episode of Sped Talks. Until next time, this is Donna Steele saying goodbye.